A very good evening. Welcome to our next episode of C3 with N3, that is Cheat Codes and Concepts with Dr. Nikita Nanwani Nathani. And I'm Dr. Nikita here, your mentor, educator, and friend. I hope you all are benefiting out of the various mnemonics and cheat codes that I keep sharing with all of you in all my sessions. And we are here to discuss the cheat codes, the easy mnemonics about substance abuse or the various drugs of abuse. Like, for example, this is common in all your, the toxicology part of FMT, and also in psychiatry, you get questions on this. For example, you'll get question on tactile hallucinations, Magnan symptom, amotivational syndrome, run amok, all of these. So these features are seen in witch poisoning. What generally happens is in the exam hall, we tend to get confused कि क्या answer है. If you have easy mnemonics handy, it makes, the recall very, very easy. Right? So I hope all of you are aware of all the amazing sessions, both free and for Plus subscribers, which are going on the Unacademy app. All you need to do is download the Unacademy Learning app. For subscription, you can use my referral code Dr. Nikita for additional discounts. And we also have Iconic subscription, which is both Unacademy and Prep Ladder together. You get in one subscription, so both live and recorded. Apart from that, there is Operation NEET PG 2021 and high yield topics course going on for both NEET PG and FMG on the platform for subscribers. So I hope the Unacademy app is on October 22nd. So it is Radiology TND that I'll be taking. So you have Radiology test in the morning. That is 50 question test. And then from 12:30 to 2:30, we would be having discussion of those questions in radiology. After that, that is on October 22nd. Then you have on October 23rd, where I've started the revision program for NEET PG 2021 for INI-CET. So we have the third session in this revision program. We are done with 2, where I've discussed the TNM staging of cancers and the surgery scoring systems. We have the third session on October 23rd. And then I'm starting with comprehensive course for NEET PG 2022 radiology on October 26th, right? And in November also, you have something amazing coming up. There would be grand tests and discussion on the Unacademy platform. Then you would be having radiology MCQs to be discussed separately, like the radiology TND going on. So you will have on November 3rd, it would start. And plus we have the live quiz features on the Unacademy app, which is free and available to all. So we conduct T20 at 8 p.m. and you have another quiz at 9 p.m. for 2022 aspirants. Apart from that, I also conduct quizzes at 9 p.m. and 11 p.m. daily. The link is posted on the Telegram groups just before we start the quiz. Right. So now without further delay, let's start with our class today about the substance abuse. So this is the table that I am focusing on. Looks like a very short table, but each of these is a very, very important question that can be asked on the entire table. It's absolutely important. Right. So let's start one by one. Number 1 is cocaine. Right. So these are the features that we are seeing in the various intoxications. Where it is withdrawal, I'll mention that it's a withdrawal. So cocaine intoxication, whatever points I have enlisted, these are what are asked in your exam as questions. So very, very important to know. So this is a very frequently asked question. Magnan symptom, or basically it is tactile hallucinations. So the patient feels like, there was a question asked in one of the exams. A patient feels that there are insects creeping on the skin. So basically tactile hallucination is seen with cocaine. Black pigmentation of teeth and tongue is seen with cocaine. And cocaine is a sympathomimetic. So it gives sympathomimetic symptoms like tachycardia, hypertension. It can even give angina and MI due to vasoconstriction and vasospasm. It can lead to gangrene. So remember, it is sympathomimetic. So how do we remember Magnan symptom, which is very, very important, and the black pigmentation? These are very important. So you just need to remember this is कि cocaine जो है, the 2 things that we remember from the term cocaine. Number 1, cocaine मतलब cockroach. Cocaine मतलब cockroach और cocaine मतलब Coca-Cola. Right? So cocaine, matlab cockroach or Coca-Cola. So these are the 2 symptoms, very easy. So the patient feels that like there are insects, that is cockroaches on the skin. And these cockroaches, it looks like there are magnified, it is magnified on the skin. So that is your magnon symptom. So that is how you integrate. Cockroach is magnified on the skin. That means magnon symptom. And Coca-Cola is black in color. So it causes black pigmentation of teeth and tongue. Black pigmentation of teeth and tongue is seen with cocaine. Coca-Cola is black, right? Next one is your cannabis. Next one is cannabis. So again, we decode this term cannabis. Yes, I have shared this mnemonics on my plus course as well, where I have taken a dedicated course on toxicology, 9 hours, entire toxicology. So all the plus subscribers, if you have attended those sessions, well and good. If you have missed those sessions, do watch them. Your entire toxicology will be covered. I can see some of my students here from the plus platform answering to the mnemonics. So cannabis, decode this term, divide this term canna and bis. So what happens with cannabis is, canna matlab the patient turns carnivorous and the patient says bis is bus. Bus ho gaya, mujhe aur kuch nahi karna hai. So cannabis, carnivorous. Carnivorous is what? Like the patient kills everyone, run amok. So carnivorous helps you to remember run amok. Run amok means running wild. The patient goes like mad and runs behind people, and there is instinct to kill someone. So that is run amok. So carnivorous, killing someone, run amok. Amotivational, there is no motivation to do anything else. The patient says, bas ho gaya, mujhe aur kuch nahi karna hai. So cannabis, bas matlab amotivational syndrome. Alright. Then next is your LSD. Okay? LSD. What are the mnemonics for LSD that we have seen? LSD, remember it as love, sex, dhoka. So suppose there's a person who has been to a trip, let's say to Bangkok, and the patient had a bad experience in Bangkok, love, sex, and फिर धोखा हुआ. So whenever the patient comes back from Bangkok, the patient has this PTSD जैसे हो जाता है कि patient को हमेशा वो flashbacks आते रहते हैं. So the person basically has bad trip. The person had bad trip experience, and that keeps flashing back. The bad experiences always give us a flashback, right? So easy to remember, LSD is love, sex, dhoka on a trip that leads to a bad trip experience and flashbacks, right? So that is about LSD. Next one is amphetamine. Next one is amphetamine. So you can remember amphetamine again from the term itself. Amphetamine is PH in its term, so it causes paranoid hallucinatory syndrome, as you can see. So it causes paranoid hallucinatory syndrome. And whenever we say paranoid, the first thing that comes to our mind is schizophrenia. So they can give you which of the following substance abuse presents like schizophrenia. So paranoid hallucinatory is amphetamine. So that is your amphetamine, paranoid hallucinatory syndrome and schizophrenia, right? Next is alcohol. Next is alcohol. So for alcohol, remember 3 M's. 3 M's are important for alcohol. That is Mc-Evan sign, morbid jealousy, and Mellanby effect. Each of these in itself is a question that can be asked in the exam. What is Mc-Evan sign? Can someone tell me? Mc-Evan sign is seen in what stage? What stage of alcohol intoxication? It is seen in stage of coma. It is seen in stage of coma, right? So whenever you pinch the neck or the face, the pupil dilates. So that is Mc-Evan sign. Morbid jealousy, like your Othello syndrome, we have seen morbid jealousy, alcohol. Then you have Mellanby effect. What is Mellanby effect? The alcohol, the features, the symptoms that you see, they are maximum when the levels of alcohol are rising, rather than when the levels of alcohol come to a plateau. So when the levels are rising, that is the time when the patient has maximum intoxication features. That is Mellanby effect. So all of these is important. Remember the 3M for alcohol. The 3M for alcohol is important. Next, this is opioid withdrawal. I'm not talking about opioid intoxication. If I have to talk about opioid intoxication, it causes pupillary constriction, that is meiosis, and it causes respiratory depression, and it causes constipation, right? That is what it causes. So meiosis, respiratory depression, constipation, we have read this in pharmacology already. Exactly opposite will happen in the withdrawal, intoxication का opposite. So meiosis की जगह पे midriasis होगा, constipation की जगह पे diarrhea होगा, and then you have characteristic withdrawal features like increased secretions. There is lacrimation happening, rhinorrhea happening, there is yawning, there is piloerection, right? So yes, absolutely right, cotton shoes. So opioid withdrawal can be best remembered with the symptoms that student will get in the examination hall. So imagine you are going to the examination hall. Suppose it's your day, the grand day of NEET PG exam. You are going to the examination hall. It's 9:55. The exam is about to start at 10 o'clock. What state you are in? क्या होता है सबसे पहले? You have, you keep thinking कैसा पेपर आएगा, कैसे क्वेश्चंस आएंगे. So you have पेट में जो गुड़गुड़ होने लगती है. So that is your diarrhea. तो पेट में गुड़गुड़ होने लगेगी. जैसे ही 10 o'clock होंगे, you start seeing the questions and you will have big eyes looking at the questions that you have. This should not happen with anyone. It's just to, remember our mnemonics. I'm sure you all will come happy after giving the exam for NEET PG with all the cheat codes that we share with you. So there will be midriasis. क्योंकि questions देख के आपको midriasis हो जाता है कि ये कैसे questions है, तो आप आंखें फाड़ फाड़ के देखते हो. फिर उसके बाद आपके रोंगटे खड़े हो जाते हैं क्वेश्चंस देखे, पाइलो इरेक्शन हो जाता है, आपको रोना आ जाता है, you feel like crying, lacrimation हो जाता है. When you cry, आपके नाक से भी पानी आता है, rhinorrhea होता है, and the questions you feel like are so difficult, you feel like going to sleep, so you start yawning as well. So there is yawning. So these are the features of opioid withdrawal. Basically, you have to remember the examination hall, what is the state of a student that goes to. We all have been through the state, everybody goes through it. So you have to remember this is opioid withdrawal. So you want to withdraw from the exam hall. You feel like running away from the exam hall. So remember, these are all the features of opioid withdrawal, not opioid intoxication, right? So what are the features? Pet mein gurgur, diarrhea, midriasis, piloerection, and you start crying, lacrimation, running nose, rhinorrhea, and you feel like sleeping and yawning, and you feel like withdrawing from the exam hall. So these are opioid withdrawal symptoms. Okay, once you know these are opioid withdrawal, opposite will be opioid intoxication. So intoxication में constipation होगा, pupillary constriction होगा, और respiratory depression होगा, right? Next one, Phencyclidine. What do you see with Phencyclidine? Now, Phencyclidine, with Phencyclidine, we write Phencyclidine like this for a mnemonic. PH की जगह हम लिखेंगे F. So it is Phencyclidine. Alright. So F से we basically remember fairy. ठीक है? Phencyclidine is basically fairy. When you tell fairy tales, okay, when you tell fairy tales to a child, or you yourself while telling the fairy tales, we go into a different world. While we are narrating or we are listening to the fairy tales, हम एक अलग ही दुनिया में चले जाते हैं. So we get dissociated from our real world and we go into another world. So that is your dissociative anesthesia or dissociation. So fairy tales give rise to dissociative anesthesia, and fairy is also called as angel. So if they ask you angel dust, which is very frequently asked, is other name for which drug? It is Phencyclidine, because angel is fairy. That is Phencyclidine. Okay, that is Phencyclidine. Next one. Okay, next one to hai nahi, we are done with the table. So just a quick review of whatever we have seen up till now. So we saw cocaine, cockroach, and Coca-Cola, black color. Cockroach is Magnan syndrome, which is also called cocaine bugs or tactile hallucination. And you get black colored teeth and tongue. You get black teeth and tongue, Coca-Cola. Phencyclidine, fairy, dissociative anesthesia, also called as angel dust. LSD, love sex dhokha on a trip, leads to bad trip, which keeps giving flashbacks. Remember that flashbacks have also been described with cannabis as well. But the best answer, if you have to choose one, would be LSD. Amphetamine, paranoid hallucinatory syndrome, similar to schizophrenia. So you have run amok and amotivational syndrome, which is seen with cannabis. So can someone tell me what is the smell which you have in cannabis? What smell, what odor is seen with cannabis? Madhuri, regarding the list of all the topics that I have taken, there is the link in the Telegram group description. You can check there. The PDF has been shared for some of the sessions till July, and the later part are not there. Okay, very good. The smell is burnt rope. In cannabis, you have burnt rope smell. I have discussed the mnemonics for all these in my toxicology course already, right? So we'll come to the next question where I'll give you a chance to answer. Before that, all the Plus subscribers present and the future ones, remember the referral code Dr. Nikita. Please watch this entire course on toxicology. I've taken the entire toxicology through the cheat codes and mnemonics. I had taken, these are the dates. So if you want, you can go through these dates. August 13 to September 6. I had taken 6 classes are there of 1.5 hours, 1.5 hour each approximately. So basically it is your 9 hours where I've discussed entire toxicology with MCQ practice as well. So it's a very, very high yield course. All the mnemonics for all the plant poisons, animal poisons, snakes, sab kuch I have discussed in that. Apart from that, I've also taken a free session, a special class on toxicology cheat codes. Both the courses, the plus course and the free live class link, I'll share in the comments once the session is over. So check back in the comments. I'll share the links there. Okay. Now, if I ask you, identify this plant. I'm sure all of you will know this, especially the students who have attended the class, the toxicology course. What plant is this? Of all the drugs that we have discussed, which of these is derived from this plant? 9. Miss Medico, this is not resinous. You are right in the sense that resinous will also have red colored plant. That is where I have, the cheat codes help to differentiate. This is not resinous. Anyone? Absolutely right, Arup. Absolutely right. So this is your erythroxylon coca plant. How do you know this? Red color dikh raha hai. Red color dikh raha hai. So erythro is red. It is erythroxylon coca. So you will get cocaine. And what do you see with cocaine? Magnum symptom and black colored teeth and tongue. So that is how you see the black colored teeth, the black colored tongue. Black is Coca-Cola. Coca-Cola is cocaine. So remember, it's a very, very important question. High chance of being asked in your exam. Okay. So this is the final thing for our revision. Let's quickly revise. What do you think? Number 1, A motivational syndrome is seen with. You have to match the column. A motivational syndrome is seen with. Right? A motivational syndrome, person is not motivated, bus ho gaya, bus is cannabis. So that is your option H, cannabis. Delirium tremens, I have not discussed this, but I'm sure all of you know this. Delirium tremens is seen with alcohol. Alcohol intoxication or alcohol withdrawal. What is it seen with? Right, it is seen with alcohol withdrawal, 48 to 72 hours, you see that. Yawning, when do you yawn? In the exam hall. Opioid withdrawal, that is option D, not opioid intoxication, opioid withdrawal. Magnum symptom, cockroaches are magnified, cocaine, option A. Dissociation, when do we get dissociated? When we listen to the fairy tales, Phencyclidine, that is option E. Bad trips, flashback, LSD, love sex धोखा जब होता है तो ये हो गया LSD. McEwan sign, morbid jealousy, Mellanby effect, the 3 M's is your alcohol. So option B, alcohol. Black tongue, black is Coca-Cola, so it is seen with cocaine. It is seen with cocaine, right? So can you tell me what formula do we use for alcohol? What is the name of this formula that we use for alcohol levels estimate करने के लिए? Alcohol consumption levels. What formula is used? It's again a very frequently asked question. Anyone? Very good, Harini. Absolutely right. So that's your Widmark formula. Okay, so again, this is a very, very frequently asked question. Widmark formula is used for alcohol. So you can remember for alcohol, the 3 M's that we saw plus M ka ulta is your W. W is ulta of M. So 3M plus the Widmark formula. So M and W, they go together. We have seen in many cheat codes in our immunodeficiency disorders also. So M and W, 3M and W, that is Widmark is used for alcohol. Okay. So this is the free live class that I was mentioning that I have taken on toxicology mnemonics again. It's a 1-hour session I've taken in July. As I said, you can watch this irrespective whether you have subscription or no subscription to the Unacademy platform. All you need to do is download the Unacademy Learning app, and I'll share the link in the comments. Okay, in the comments and on Telegram group as well. Definitely watch this session. It will give you an extra edge in your preparation again. Okay, and even the plus course, the entire 9 hours ka link also I'll share in the comments after the session is over. Now, when do you have your next free class? The next free live class on the Unacademy app, not the YouTube live session. Please make a note of it. It is on 22nd October. It is on 22nd October, that is day after tomorrow, 7:30 p.m. It's going to be a very, very high yield session. I'm not disclosing the topic now, but yes, like any other session, it's going to be very, very high yield. So please make a note and mark your calendars day after tomorrow. Your next YouTube live session is going to be tomorrow, 21st at 1 p.m. And I'm going to simplify your topic of pressure volume loop or in cardiology that you read in physiology and medicine. So what pressure volume loop is seen in which valvular condition? It's very, very easy once you understand the concept of it. So I'll decode the concepts tomorrow of your pressure volume loop tomorrow 1 p.m. Okay, ki aortic stenosis, mitral regurgitation, how does it affect the pressure volume loop? We will see tomorrow 1 p.m. Then day after 7:30 you have a free live class. And plus courses I've already mentioned. You have classes on October 22, 23, then you have October 26. So the remaining days in October you have session almost practically every day. So make the best of all of this. Again, a reminder about the referral code Dr. Nikita for all the future subscribers. That will give you additional 10% discount. So, yes, that's all about our today's session. I hope all of you have enjoyed these mnemonics and the cheat codes, and it has simplified this table of the substance abuse. What are the classical features seen in each of these? And Rohini, the CNS Google Forms, let me see if in the free class we can discuss that, the neurology test that we had on the Telegram group. I'll see if I can discuss that. If not, definitely it's going to be high yield for sure. Okay? Yeah, so that's all for today, guys. As I said, check back the comments after the session for the links of the toxicology classes, both free and plus. And I'll see you again on this YouTube channel tomorrow, 1 p.m. with the pressure volume loop simplified with concepts. So good.